This is the view after enucleation. The scope is advanced through the external sphincter and into the wide open prostate channel. The next step is to ensure that there is no bleeding from the prostate capsule. The laser fibre is defocused or brought back from the surface of the prostate capsule so that a gentle blanching effect occurs. This seals off any small blood vessels that may be bleeding and also blows any small blood clots off the surface of the capsule and up into the bladder, from where they can be washed out later. To wash small clots from the bladder is filled with saline, then emptied and refilled. In this view, the two ureteric orifices, or openings in the bladder from the ureters, can be seen as the bladder is filled. You can also see one of the 3 prostate lobes floating in the bladder. As the fluid is emptied from the bladder, notice how clear it is. There is no blood. The final phase of the operation can now begin. This is called morcellation. Morcellation involves the use of a tissue morcellator, which gently sucks the prostate lobes onto the tip of a metal cylinder. There is a small hole in the cylinder that the prostate is sucked into, and then a blade on the inside of the cylinder rapidly chops small pieces from the prostate. These small pieces are then suctioned out through the cylinder to a container on the outside of the patient. During morcellation, it is very important that a clear view of the end of the morcellator cylinder is maintained, and that this is kept in the middle of the bladder and away from the bladder walls. The bladder is kept full of fluid during morcellation to keep the bladder wall away from the morcellator instrument. Morcellation is a safe and efficient way of removing the prostate lobes from the bladder. The prostate tissue can later be analyzed under the microscope to detect any cancerous changes, which can be found unexpectedly in around 8% of men who have surgery for prostate obstruction. Prostate tissue analysis is not possible with ablation techniques and is often partly destroyed by burning during resection techniques, which makes analysis of tissue either impossible or inaccurate. The tissue removed during HoLEP is of good quality and is suitable for accurate tissue diagnosis. The tissue morcellator is capable of removing around 5 grams of tissue per minute. This means that even very large prostate lobes can be removed from the bladder within a reasonable amount of time. Sometimes, towards the end of morcellation, a tougher, more solid nodule of prostate tissue remains. This is often referred to as a beach ball. Beach balls can be difficult for the morcellator to handle, but are usually small enough to remove with tissue grasping forceps. This beach ball is being gradually worn down to a size suitable for the tissue graspers. Once small enough, pieces can be gently removed by grasping them under direct vision, and these pieces can be removed to the outside of the patient. After morcellation, it is important to check the prostate channel in case any small pieces of prostate have floated down into it. In this case, a small piece of detached prostate was found and pushed back up to the bladder, from which it was removed with the morcellator. This is the completed prostate channel.